Doctors warn that one of the most commonly ignored pains in adults over 50 can quietly signal something more serious. Medical experts say dismissing it as just getting older is a mistake many people later wish they had not made. Richard is 64 years old. He lives in Ohio, is recently retired, and spends his mornings walking his dog and his afternoons fixing small things around the house. He prides himself on staying active and rarely complains about his health. One afternoon, while carrying groceries from the car, he felt a dull ache in his left shoulder and upper back. It wasn't sharp. It didn't stop him. By the next day, it was mostly gone. Over the next few weeks, the discomfort returned now and then. Sometimes it showed up while he was walking. Other times it appeared when he was resting in his chair. It never lasted long, and it never felt severe. Richard assumed it was a muscle strain or arthritis. After all, he told himself, people his age have aches. That's normal. What many adults don't realize is that ongoing shoulder or upper back pain, especially when it comes and goes, is something doctors pay close attention to. This type of discomfort can be linked to several underlying processes in the body. Physicians often look at how pain behaves, where it appears, how long it lasts, and whether it shows up during activity or rest. While it may be related to muscles or joints, it may also indicate that something else deserves evaluation. Medical professionals explain that pain is not always loud or dramatic. In older adults especially, the body doesn't always send clear signals. Discomfort that seems mild can sometimes be the body's way of asking for attention. Doctors often say that when pain appears repeatedly in the same area without an obvious cause, it's worth discussing with a healthcare provider. So why do so many people ignore it? For many seniors, the first reason is simple. They assume pain is a normal part of aging. They've been told this for years, by friends, family, and sometimes even themselves. Another reason is daily life. Appointments take time. People don't want to interrupt routines or worry loved ones. There's also fear. Some avoid doctors because they're afraid of what might be found. And finally, this kind of pain often comes and goes, which makes it easy to dismiss. When it disappears, people feel reassured, even temporarily. Doctors say there are certain warning patterns they pay attention to. Pain that returns repeatedly in the shoulder, neck, jaw, or upper back. Discomfort that appears during physical activity or emotional stress. Pain that is new, unexplained, or different from what a person has felt before. Doctors also consider symptoms that appear alongside pain, such as unusual fatigue, shortness of breath, lightheadedness, or nausea. These signs don't automatically mean something serious, but they are signals that medical evaluation may be appropriate. In Richard's case, his wife noticed something he didn't. He had become more tired lately. He was taking more breaks during walks. One evening, when the shoulder pain returned while he was sitting quietly, she suggested he mention it at his next checkup. Reluctantly, he agreed. When Richard spoke with his doctor, the conversation focused on listening. The doctor asked detailed questions about the pain, his activity level, and how long it had been happening. No assumptions were made. No conclusions were rushed. The doctor explained that in adults over 50, even subtle symptoms are worth reviewing, simply to understand what the body is communicating. What happened next wasn't dramatic. There were no sudden emergencies. Instead, there was clarity. By paying attention early, Richard and his doctor were able to look at the bigger picture. The focus remained on awareness, monitoring, and understanding his health more fully. Medical experts emphasize that noticing pain does not mean panic. It means awareness. The goal is not fear, but information. Listening to the body allows doctors to make thoughtful decisions and helps patients feel more confident about their health. If you're over 50 and experiencing recurring pain that doesn't quite make sense, doctors say it's reasonable to talk about it. Not because something is definitely wrong, but because understanding symptoms early can make a difference in peace of mind and overall care. Your body communicates quietly at times. Taking a moment to listen can be an act of self-respect, not worry. This video is for educational purposes only. Always consult a qualified medical professional.